Hi everyone, and welcome back to the channel. Today we read talking about a super important topic. What kinds of diseases can we catch from our adorable cats? And just as importantly, how can we protect ourselves and what precautions should we take? If you love learning about cat care and health, don't forget to subscribe and support the channel. So, let's dive into zoonotic diseases. These are illnesses that can be passed from cats to humans. While most diseases only affect cats, some can jump to people. This video will cover the most common ones and share simple tips to keep you and your loved ones safe. Of course, if you ever need specific medical advice, always check with your doctor or healthcare provider. First, what's the actual risk? For most of us, the chance of catching a disease from a cat is pretty low. But if someone in your home has a weaker immune system like babies, older adults, people with HIV/AIDS, or those undergoing chemotherapy, they're more vulnerable and extra caution is needed. Now let's look at some of the key diseases you might hear about. 1. Cat scratch disease. This is caused by a bacteria called Bartonella henselae, which lives in infected cat saliva and fleas. As the name says, it spreads mainly through scratches, but bites or contact with open wounds can also pass it on. Cats usually get infected from flea bites. In humans, symptoms might include swelling or a blister at the scratch site, swollen, and painful lymph nodes, fever, headache, muscle and joint pain, fatigue, and loss of appetite. Most healthy adults fully recover, but it can take a few months. If someone's immune system is weak, the disease might cause serious problems like infections in the eyes, brain, or heart, and sometimes requires antibiotics. About 40% of cats carry these bacteria without showing symptoms. To lower your risk, avoid rough play, especially with kittens. Wash your hands after petting cats, keep cats indoors, and stay on top of flea control. Those with weakened immunity should avoid close contact with kittens under 1 year old. 2. Pasteurella multocida. This bacteria lives in the mouths of most cats and is often part of infected cat bites that need medical care. Bites can cause pain, swelling, and redness within a day or two. Antibiotics usually work well, but sometimes more serious infections can happen. So, keeping your cat calm and avoiding bites helps keep you safe. 3. Salmonella poisoning. You've probably heard of salmonella from food, but cats can carry it too, especially if they eat raw meat or hunt wild animals. They can pass it through their faces. Humans infected with salmonella may experience diarrhea, fever, and stomach cramps within a few days. To minimize risk, feed your cats cooked or commercial food, keep them indoors, wear gloves while cleaning litter boxes or gardening, and wash your hands afterward. Now, onto some pesky parasites. Fleas. These tiny critters cause itching and irritation in both cats and humans. They can also spread diseases like cat scratch disease. Cats grooming themselves may swallow fleas, leading to tapeworm infections. Though rare, humans can accidentally ingest fleas too, so regular flea control is key. Scabies, mange, caused by a mite called Sarcoptes scabiei. This skin parasite can move from cats to humans, causing red, itchy bumps. Treatment includes topical creams for the itch, thorough pet treatment, and careful cleaning of clothes and bedding to stop the spread. Moving on to intestinal parasites, something every cat owner should know about. Parasites like roundworms, toxocara, and hookworms, ankylostoma, can infect both cats and humans. Kids are especially at risk because they play outside and can come into contact with soil contaminated by cat feces. While many people don't show symptoms, serious illness can develop in some. Here are a few examples. Visceral larva migrans. This happens when toxocara eggs are accidentally swallowed, often from not washing hands properly. The larvae can travel to organs like the liver or even the brain. Symptoms might include fever, fatigue, coughing, and stomach pain. Ocular larva migrans. Larvae migrating to the eye can cause vision problems, unusual eye movements, and discomfort. Cutaneous larva migrans. Caused by hookworm larvae, this results from skin contact with contaminated soil, causing itching, inflammation, and red, winding skin rashes. The good news is simple hygiene habits make a big difference, such as washing hands before eating, cleaning soil off vegetables, and keeping cats dewormed and checked by your vet regularly. Now let's talk fungal infections. Ringworm is a common fungal infection that's often misunderstood. Despite the name, it's not a worm, but a fungus causing round, red, itchy skin patches with scaly edges. Cats with ringworm often have dry, scaly, or bald patches. This infection can spread to people by touching an infected cat or contaminated surfaces. It can linger in your home for months, so isolating infected cats and deep cleaning are important. Children are especially vulnerable, so extra care is needed. Finally, protozoal infections are caused by tiny, single-celled organisms. Cryptosporidiosis causes diarrhea, vomiting, fever, and stomach cramps, spreading through contact with infected cat feces. Giardiasis also causes gastrointestinal symptoms and spreads similarly. Most human giardiasis cases come from contaminated water or food, not directly from cats. Annual fecal exams for your cat and following your vet's treatment advice help prevent these infections. Always wear gloves when cleaning litter boxes and wash your hands thoroughly afterward. One more important protozoal infection to be aware of is toxoplasmosis. It can be serious for pregnant women and people with weak immune systems. Cats catch it by eating infected rodents or birds and shed the parasite in their feces for a short time. Practicing good litter box hygiene like wearing gloves and washing hands helps keep everyone safe. So, to wrap it up, cats can carry some germs and parasites that may pass to humans, but with regular vet care, good hygiene, and common sense precautions, you and your furry friends can live happily and healthily together. If you found this video useful, please hit the like button and subscribe for more pet health tips. Have questions or stories about your cat? Drop them in the comments. I'd love to hear from you. Thanks for watching, and take care of yourselves and your whiskered companions.